Good afternoon. Thank you so much for being here today. My name is Dr. Katie Loth, and I'm honored to stand here before you as a clinical dietitian, a public health researcher, and most importantly, a proud mom of 3. Each of these roles shape my perspective today, but I want to make clear that the views that I'm expressing as I talk to you today are my own. Over the last few weeks, I have had a front row seat to see how the drastic and chaotic changes made by the new administration are impacting our ability to do high-quality public health research. And it's not good. Funding cuts, firings, censorship, and political pressure are slowing down public health progress. And if we don't do anything about it, if we don't stand up for science, discoveries we should be making this next year may not happen for another 10 years. And we don't have time for that. Woo! Right now, we face a number of urgent public health challenges. More than 1 in 4 families in Minnesota don't have enough food, which impacts 150,000 children. Our youth are facing a growing mental health crisis, and barriers to care leave most of them struggling in silence. Preventable diseases, once nearly eradicated, are resurging due to vaccine hesitancy fueled by misinformation. Continued funding of public health research is absolutely vital to addressing these and other issues for Minnesotans. Research is important because it provides unbiased information to guide our decisions. Public health research helps everyone, from doctors to lawmakers to families and individuals. Let me give you a specific example to show you how all of this is connected. Every week as a clinical dietitian, I sit with at least one patient who has just received a new diagnosis of diabetes. They feel overwhelmed, scared, and desperate to stay healthy for their families, but they don't know where to start. Thanks to public health research, I know how to guide them towards small, realistic changes that will have the biggest impact. I can offer culturally relevant guidance tailored to each patient's specific needs that is also backed by science. But information alone isn't enough. Many of my patients still struggle to afford the healthy food that they need. This is where public health policy comes in. I connect my patients with food assistance programs like SNAP to help them succeed. These programs exist because public health research highlighted a problem and policymakers acted. And research doesn't stop when a policy is made. It helps to evaluate and improve upon that policy over time. We all make better decisions when we have better information. And yet today, public health research is under attack. Funding freezes and cuts are happening right now. These aren't just theoretical threats. As one of many examples, the current administration paused $65 million in funding for Alzheimer's disease, derailing progress on curing a disease that affects millions of families. To protect the health of Minnesotans, we must stand up with science. Science doesn't just help us solve problems and make decisions, it also helps us find the problems to be solved. That's why I'm so worried about censorship. It slows progress and puts communities at risk. When funding is cut, when scientists are silenced, and vital data begins to disappear, we all suffer. For example, scientists have collected data on the health behavior of young people for over 3 decades through the Youth Risk Behavior Surveillance System. This data helps shape programs and policies that address issues like teen substance abuse, mental, and physical health. However, the current administration is attempting to limit public access to this data, placing programs and policies that support our young people's health at risk. To prevent political interference from undermining public health, we must stand up for science. Standing up for science is a team effort. Don't sit out because you assume somebody else will stand up for you. We need you to act, and I know that you're all ready because you are here today. First, we must tell our stories. Science isn't just about numbers. It affects our everyday lives. Talk to your family, your friends, your neighbors, your elected officials. Share how science has impacted you. Maybe it was the early intervention that helped your child with special needs to thrive. Maybe it was the policy change that made school meals free across Minnesota and enabled your kid to get breakfast and lunch. Maybe it was the medical advancement that gave someone that you love more time. These stories matter. They connect us, and they help us find common ground with those who may not yet understand what is at stake. Second, we must demand transparency. Fight for open access to knowledge and the right of scientists to communicate without political interference. Third, we must advocate for funding. Public health research is not a luxury. It's essential for improving health outcomes and building a future where everyone has the opportunity to thrive. And finally, we must hold our leaders accountable. Elections matter. Vote. Policies matter. Speak up. Call your representatives and demand that they stand up for you by standing up for science. Now is the time to act, to stand up for science and protect the future of public health. Will you stand up for science?